Good morning, good afternoon, good evening. My name is Joshua, the founder and director here at El Terreno, and this is the final presentation of all the final presentations of this season of Gabby, who has been with us for 16 weeks here at El Terreno. And we've also got Alice, who's part of the project. Great to have you all here to share a little bit of the work looking at ancestral midwifery, an absolutely fascinating topic with loads of nuances and details and um, something that's got a lot of potential, I feel. And I'm really glad because this project started off at the beginning of the year that it's been able to continue throughout the summer and to be able to get to where we are now. I won't give any more away. I will pass it over to Gabby to explain more.
Yes, let me share my screen. Can you see it?
Yes.
Okay, so thank you everyone for joining. I'm gonna tell you now about this whole project that I've been doing for the past 4 months about legitimizing ancestral midwifery. I wasn't alone. I was also with Soliana from the USA, from Alice, who's from France, and then from Zoe, who's also from the USA. And then together we worked on this project. So I'll talk about some context elements, research methodology, the results that came out of it, the problem definition, then the design of the project, some objectives we set, and then the delivery of the project. I'll finish with a quick evaluation and then future steps. So basically here we're in Atandawa, which is close to the city of Guaranda in the province of Bolívar, that has around 200,000 inhabitants, majority of which live in rural areas. A lot of them are also indigenous. They identify themselves as indigenous. And there is also some context elements about maternal health. The first one is that 15% of teenagers between 15 and 19 years old have experienced pregnancy. The mortality rate is also really high, with 55 per 100,000 births. So that's pretty high. And those are like public health issues in Ecuador, and they've improved, but they have been way worse like 20 years ago. And so in 2008, the government included healthcare as a fundamental right in the constitution. And with that, they also started an intercultural health program, which basically tries to integrate ancestral medicine and knowledge into the more Western conventional public health system of Ecuador. Some numbers about birth is that giving birth in a private hospital costs about $1,000. In a public hospital, it's free of charge, but there are a lot of medicine shortages. And so it's possible that while the woman is giving birth, her husband or mother needs to leave, buy some medicine in the pharmacy, and then comes back. And then the third option is to give birth with midwives, which is free of charge. And it's basically based on the family's generosity. So if they have $5 or $10, they would give that to the midwives, but it's not automatic. Another important thing, as Joshua said, is that this project is a continuation of a previous interns. And it's important to have like their objective in mind. So they tried to support pregnant women in the community of San Juan de Yundongo, which is next to where we are right now, to receive adequate information, access to healthcare services, decision-making power for a birth that is medically safe, emotionally respectful, and culturally appropriate. So we started off a bit with those elements. And then because we are using the design thinking methodology, we started with the first phase that is empathizing. So basically we did interviews, community engagement, stakeholders mapping, focus group, to then learn from ourselves how it is like and get people's opinion on it and not only rely on secondary data that we collected. So from that research, we learned that in every health center, there are intercultural health responsibles, and they are basically the link between the midwives and the public health system. The midwives told us about the big gap between ancestral and Western medicine, especially regarding birth. So, for example, midwives are most trusted in communities. And so sometimes when a woman is in the process of giving birth and then there is a problem, her family or her decide not to send her to the hospital, which can create problems because if then she decides to go very last minute, they have to do very intrusive surgeries that really fuel this mistrust. And then there is also a lack of recognition from the public health system that a bit consider the knowledge of midwives as incorrect, old, and yet they don't really trust it. And then we also had the side of the public health themselves with the Ministry of Health, for example, that told us about their intercultural health program and mostly the articulation process that the midwives can go through. So it's basically a process that midwives go through if they want to have institutional recognition. So, for example, being allowed into the hospitals to help a woman give birth. So from that and the context elements, we had to make some decisions. For example, change the main beneficiaries from pregnant women to the midwives. That's also due of the fact that we didn't have much access to pregnant women. So if we wanted to do like a project that had impact, we had to change the beneficiary. So we decided to change it to the midwives. Things to take into consideration is that midwives really need formalization and recognition. That's what they told us. And then they also wanted some internal strengthening because right now they're they were very isolated in their communities, but didn't know each other that well. Because they also would like to achieve genuine intercultural health because they're always willing to learn from the doctors, but then it's also important that it's bidirectional and that the doctors also learn from the midwives. So from all of this, we defined our problem statement, which was how might we support midwives and their ancestral expertise to be legitimized through internal strengthening and facilitation of relationships with other parties involved in bettering maternal health. So yeah, this really means that we tried to strengthen the midwives among themselves and strengthen their relationship with other people. And so once we had an idea of that and of the context, we did a focus group with the Ministry of Health. Those are pictures of that focus group. And we basically really tried to set objectives based on what had been done by the previous interns and what we found out during the interviews. And so the objectives of the midwives were to be more recognized as a group. That means also like create a network of midwives. For the network, they wanted a dedicated space to have meetings. They also wanted to improve the dialogue they have with the public health. And then last but not least, they also really wanted new midwives to be trained because right now midwifery is quite declining. There are not many young girls who want to learn profession. So from those objectives, we decided to offer some propositions of activities to the midwives based again on discussions we had with mentors and also on what had already been done with previous interns. So we offered to go to the National Congress of Midwives. We offered to visit Amupakin, a midwife association in the Amazon. We proposed that the president of Amupakin comes for a day to do a workshop at El Terreno to visit another midwives association in a relatively nearby city. We also offered to go visit hospitals. And then on the side, there was also like a more multimedia project offering to do like a brochure, news article, documentary. Yes, they were most interested in inviting the president of Amupakin to El Terreno, but we couldn't continue because of budget constraints. So we focused then more on hospital visits. So then going back to the objectives that the midwives had, we first looked at the dialogue between midwives and public health. So we organized Diálogo de Saberes, a dialogue of knowledge, where we invited responsible for intercultural health and midwives so that they really could show to each other the procedures that they do. The midwives could show their rituals, their plants that they're using. So we didn't invent that. This already exists, but it's just that around Waranda, the doctors don't really organize those workshops that often. And then another thing we did to improve the dialogue between midwives and public health personnel is the visit to the Simiatug Health Center. We were there with midwives from Guanujo, Waranda, and midwives from Simiatug. So that was really nice so that they could learn about birthing room that is adapted culturally, and also they could talk with the doctors there, with the other midwives. So that really established dialogue. And then the second like big thing of this internship was that the midwives wanted to be recognized as a group. And they even wanted to go further and they wanted to formalize. So for that, they first needed to be a group that was non-existent at first. But then there are also a lot of steps that need to be taken on the way. So for example, a facilitator, an economic incentive, and an internal hierarchy. So this is basically what we focused on during this internship on this regard of governance and formalization. The facilitator, which was our role to like organize meetings and workshops, develop an economic incentives for the midwives, because if they were going to spend more time in this association, building this association, it would be nice to have some income out of it. And then the last one is internal hierarchy. If they wanted to get to formalization, it's important to have like a president, secretary, treasurer, etc. So as we were working on each of those pillars, we found Foundation Phoenix. And it was really nice to find Foundation Phoenix because they were actually at this moment looking to expand their economic activities. And they wanted to start making some soap, detergent. And then at the same time, we also met a doctor from Guaranda who makes her own soap with natural ingredients. So then we merged all of this together and we organized 2 soap making workshops using the midwives' plants. So for example, they brought their chamomiles and then we did some soap, we did some shampoo, and they really liked it. And this also like settled our relationship with Fundación Phoenix. So then that's also really good for the future because as I was leaving, we needed people to take over each of those pillars if we wanted the project to keep on existing. So for example, we needed a facilitator, and turns out that in Fundación Phoenix, there is a girl who was willing to help us do that and organize a monthly meeting in the coming 4 months until hopefully new interns are coming. For the income generating activity, there is Veronica, the president of Fundación Phoenix, and Miriam, the doctor who knows how to make the soap, who were happy to take over and keep organizing that. And then for the internal structure, Valentina, who's going to organize the meeting, also has this on her agenda to establish at least an informal hierarchy amongst the midwives. So this is really nice because this is all like pillars that we learned from mentors and a bit more theoretical. But we also went to visit some women's organizations to really learn from their business model, their governance model, the way they organize themselves in different ways. We went Simiatug to visit the Simiatug Samai organization. There's basically women that do embroideries and then they put them on bags and things like that. And then we also went to Verde Pamba, close to Salinas, to visit the Awanawarmi association. That's basically midwives who knit and then do different types of clothes. And so we learned really a lot from them. And I then made handover documents we had from those organizations to then transfer it to Veronica and Fundación Phoenix for them to also be aware of that. So yeah, in summary, during this internship, we created a group of midwives from the area, like 8 midwives. We organized 8 workshops. We built a relationship with 2 other associations. We created dialogue spaces between midwives and public health personnel. We found a facilitator to organize monthly meetings for the next 4 months in a dedicated space in Fundación Phoenix, and Fundación Phoenix also, who's gonna help us organize and continue the soap production. And so to end this presentation, I wanted to do a quick evaluation. And because the first presentation I did for this project was an evaluation of the previous project, doing a SWOT analysis, I thought it's a nice way to do another to compare them. So I think the strength of this project was our relationship with Fundación Phoenix that we established, the engagement that we've created for the midwives, and then the diversity of activities that we organized, which also contributed to build trust among the midwives. Some weaknesses, I think, is that the process of registration is pretty complex. The ministries are merging. So yeah, if we want to reach that point, it's going to be a challenge. The relationship with the Ministry of Health, yeah, we would have loved to collaborate more, but yeah, we reached also some challenges there. And we also would need to find someone qualified to continue really the formalization process and the registration. Some opportunities are the learnings we've had from other organizations and the collaboration we've established. For example, the women from Verde Pamba came to the soap making workshop. The soap making is also a really nice opportunity for midwives to have a new income generating activity. And then finally, the threats, I think the dependence on other actors now for the sustainability of the project, that's also a strength, as it doesn't depend only on interns now. However, because no intern is coming until at least January, it means that someone from El Terreno needs at least to keep a link with that project if we wanted to keep going. And the sometimes difficulty of access for midwives to come to the meetings, because we've paid for all the transportation, but because there is no continuous budget in this project, it's based on fundraising, it might be a problem. So yes, that's it for my presentation. Oh, that's not it. There are also the next steps for the future interns. So basically what I think would be really nice for future interns to take over is to develop a methodology for the demonstrations of the midwives. So when they demonstrate their rituals and everything, it would be nice to standardize it so that they are able to replicate it and sell it as a service. It would be great to visit the women's associations with the midwives to Siniatug and Verde Pamba, improve the soap production, for example, try making soap with new plants, and also really define the business model. I've started it, but it would definitely benefit some more definition and details. And then last but not least, follow up on the formalization if it's still what the midwives really are aiming at. Now for real, it's the end of my presentation. And so I wanted to thank everyone who has been part of it from the start till the end, the coordinators, the other interns, the midwives, everyone. So that's it. I will stop sharing. And oh, sorry, Alice, I didn't ask if you wanted to add something.
No,
Great opportunity, great time to add something, Alice, as one of the other members of the team.
I mean, I don't have anything to add, but I can just say that I think it's very impressive the amount of clarity you've given to the people that will hopefully follow this project in a long time. But I think when I left, I did not envision, even though I had a lot of trust in our team, I did not envision that it would be that the goals would be this clear. And I remember that was my biggest fear, is the longevity of this project. But I think you guys did an amazing job, and it's also really cool to see that such creative ideas for the economic aspect were discovered. I also remember that was our biggest issue when I left. We were really at a critical point when I left, and it really seems like a lot of what you've done has solved those issues. So congratulations, it's really good.
Was also luck to find those people at the right time.
Well, what is luck, you know? Yeah. I mean, I've got a lot of faith in this project, and I think congratulations, Gabby, receiving that support from Alice because she was really defending and wanting to make sure that those outcomes took place. So, you know, I think you really help us get to that point. And it's in the hands of the midwives now and our partners to see how it continues. But I think you've given it the best possible start, given the resources and everything you had available to you. So an opportunity to pass over to some questions or comments now. So if people can give some thought. My question, my signal dropped out for a few seconds halfway through. I don't know whether you talked about the fundraising campaign specifically and or the presentation, the workshop with the students from Missouri.
Oh, yes. Do you want me to elaborate on that?
Sure.
So yes, I think I forgot to mention when I said that I think for the midwives to develop like a methodology for those demonstrations is because they've done it during the Diálogo de Saberes and when students from Missouri came to do a workshop with midwives during their week here at Terreno. So the midwives, it's always the two same for those 2 times. They are like building a methodology without knowing it. So I think if it's like standardized now, it would be really nice. And then the fundraiser, yeah, we did a fundraiser with the 3 other girls, which was very useful because we have used every single penny of this fundraiser. So yeah, we did that with the girls, and that allowed us to pay for like transport, for um what else, like materials for the soaps and everything.
Okay. Who else has a question or comment?
Yes, as Joshua mentioned before, I move into questions. I just want to say um, how proud I am of the work you have done here, Gabby. So the relationship, the network you have built with the midwives and the trust you have earned from these communities is very remarkable. And yes, it will leave a lasting impact long after you are gone. So my question is on on your personal experience and relationship build. So, for example, what was it like earning the trust of the midwives, especially as an outsider? How did you did to have to create this trust between the community?
Well, the first time we met them was at the ministry with Alice when we organized that focus group. And after that, I was a bit stressed. I was like, oh, they like some of them were like, oh no, I don't want to give you my number or like contact the health center. I was a bit like, oh, okay. So I was a bit like a bit scared. And then eventually I was like, okay, well, we have to organize another workshop. So I'm gonna call them and then I don't know what changed. They came and I think with also the other interns, we had like a way more horizontal chat. It was like them and us at El Terreno. There wasn't anyone from the ministry. It was maybe more of a neutral space, maybe some novelty. Because I don't know, because I speak Spanish, then we could like, I don't know, create some link. And then I think I was also, I don't know, making some jokes and everything. And then also when they spread a lot of love, so it's nice to like really receive it and show that it's really important for you so that they also feel, I don't know, I think this builds also the connection.
I think
Is
someone made some tasty banana bread as well.
Yes, I think that contributed.
yes, and also is maybe do you have something you will miss most about working with the midwives or working with this community?
I feel like when we were with them, I wasn't trying to see them as like people who needed help and that I was coming here to fulfill everything. But I really felt like we were making a difference, at least a bit, you know. They were telling us like, oh, what are we gonna do when you leave? Or, you know, so they were happy with what we were giving them, like the visits, the dialogues, the organizations, the soap making. I think we offered them like a lot of new horizons, and they were, I think, grateful for that. At least that's what they told me. So I think I will miss that. I hope to find that again later.
Great. And my final question is, as always, it's the same questions for each presentation. If you could give one piece of advice to the next intern who continues this project, what would it be?
Learn Spanish. I think in this project it's very important to have at least some Spanish basis. And yeah, be ready to listen to what they need, because it has changed throughout the project. So it was important that we were hearing them. And yes, use the money well for things that make sense for them. Yeah. I don't know if Alice has anything to add.
No, I mean, everything you've said, answering Christian's questions has been reminding me of patience, just like you really need to be patient. And I think that sometimes not every intern at El Terreno, but me, for example, like I come from a very fast moving environment, and I got to El Terreno and I was like, clearly people are very motivated and clearly people show up for each other, but it just goes at a different pace. And I think that and in different ways. And I think the horizontal approach is also very important. So I guess just keep an open mind and don't get impatient, because then you'll just rush it and risk not listening to what people actually want to say. So yeah.
Thank you so much, and congratulations again.
Yes, fantastic, fantastic. Aha, another question? No question, or you can't open the microphone?
I'm sorry, no question. Just we want to say like a congratulations like this.
Great work. And you know, I think it's really important, the clarity of the legacy that you've left. We really want this program to continue. We hope that you know, whoever might be watching this recording over the next few months, when we're going to be investing in our programs in a different way to relaunch in January, that the group will continue to meet. The group will continue to build on what's already been made so that we can launch and bring things forwards. So I think you've left things in a really good way, and it's really exciting to where it goes from here. Okay. I think with that, we are complete. 16 weeks. You are now able to let loose and have a great trip on the rest of your time with your parents around here in Ecuador. Thank you to both of you for your time, effort, energy, and commitment in making this project possible. I think that, you know, while you're helping the midwives, obviously beyond that, you're helping pregnant mothers and you're helping children in an area of Ecuador that really needs that support. So really important work, and really impressive to see all the work you've completed. So congratulations, you should be proud of everything you've done.
Thank you.
A few final words from you to finish. Any final words to close?
No, I just hope this project keeps on going, because I even think it can almost become two projects, one of formalization, one of like more soap making. I think there is a lot of opportunities for this, for interns, for people here, midwives, other women. Yeah. So yeah.
Looks like Christian wanted to
thank you for every.
Is that right? Yeah.
Yes. No, I don't know, Joshua, if we have time to. I have a final question, but it's more related to Gabby's next steps. Okay.
Go for it.
So, Gabby, how do you think this experience will shape what do you do next professionally?
Hey, that's funny. When I defended my internship 2 days ago, they asked me the same thing. I think that until here, I was focusing a lot on social work, helping people. But then I don't know, creating this whole new part about soap making, more like business side, reminded me that in a way they can also be combined. Like doing business is not always necessarily bad. So I think, yeah, this is how it influenced my future, that I think now I want to go more into social economy more than like only social, Yeah, that's it.
Social
Very interesting.
entrepreneurship. Yeah, great. Fantastic. Okay, thank you everybody for joining us. Stay in touch and we'll be keeping you updated how this project goes forwards. Gabby, Alice, wishing you all the best.
Thank you.
Thank you. Bye.
Bye.
Hasta luego.